Hi guys, welcome again to your own YouTube channel Ask Your Gynecologist. I'm Dr. Sonal Parihar. As usual, I have come back with a topic requested by you all, a very interesting topic, that is female libido, female sexual drive. Now, this is a topic which normally gynecologists in our country would not discuss because it is a topic which is generally dealt by sexologists. And most of the people, most of the doctors, most of the patients are not comfortable talking. But then I thought, because I get a lot of questions on this topic and we don't have as such trained sexologists, because this is not a science that we study here. There is no separate branch that people would take, and not many people are interested also. So I thought, why not as a gynecologist, because I keep getting so many queries in my OPD, on the YouTube as well as Docwise. So I thought, why not cover this topic and tell you scientifically what happens in the body. Okay, so guys, before I start, let me just tell you that I made a video a couple of months back in which I told you how to contact me. That video was in Hindi, it was not in English. Now there are little changes in that. I have put the link of that video in the description, you can just watch it. The change is that Docwise app is not working these days. It's not working for the past I guess 1 week, and they're not paying the doctors for the last 2 months, so I don't know when they're going to start. So the change is that I have come on the other platform that is called Athancare. Athancare is another platform just like Docwise app, and you have to download it from your mobile's Play Store. I have put the description, the link in the description, and you can just log in that. Apart from that, if you don't want to go through the application, it is very much the same what I tell you how to WhatsApp my secretary. Now I keep telling this every time that this number 9358545556 is not me, it's my secretary. There are 3 secretaries who handle this, so don't call, just WhatsApp what you want to know. Don't ask any medical question. They are not doctors, just ask them how to contact me, so they will tell you how to pay. Now there are different payment options. Whatever you pay on WhatsApp will be the same as what you pay in Athancare. So it's kind of the same, because we are arranging video calling for you. Docwise does not have this facility of video calling or voice calling. It is just text messages. So it's your choice. Whenever Docwise will start again, you will come to know. I'll put a story and the Docwise people will tell you definitely. Otherwise, meanwhile, you can just WhatsApp on this number that you want to contact me, or you can download Athancare. Now coming back to the topic, female libido, that is female sexual drive. Now why in our country this topic is untouched? Why in our country most of the males are not happy with their female sexual drive? Because there is a lack of sex education, which is very, very important. Now we cannot compete with the Western world. They have already allowed, they've made sex legal after the age of 16 years, even though the girl is not mature enough. In our country, the adult age for marriage for females is 18, because we don't think they are fit for marriage or fit for sex before 18. But then the lack of education does not actually make even a lady of 20, 22 or 24 fit enough for sexual activity. That is because most of the ladies, they don't go to school, or even if they go to school, the reproductive system which is taught in the 8th or 9th class, it is not taught properly. The teachers are not comfortable, the parents are not comfortable talking to the children. Who will teach them? Lots of things are available on social media now, YouTube, Google, Insta, Facebook, everywhere you can see sex. You can see blue films, but nobody tells you the science. And whatever you read on Google, it doesn't actually enter your brain. There's nobody to teach you. So that is the problem with the Indian population or many other developing countries, that lack of sex education. Parents are not comfortable, children are not asking. You have a right to fulfill your body's demand. Sex is all right, but then you need to know safe sex. What is safe sex? Moreover, if you are married to a person, the person should be tolerant enough to understand, because the hormones of both boys and girls are different. Boys have more testosterone, men have more testosterone. Women, they are basically having estrogen and progesterone, so the sexual drive will be different. So the two people, the two species are made differently by the God. So the God has made them different, so the partner has to be very, very helpful in making the woman understand, in making the woman enjoy sex, because it has to be consensual, right? Sex education. Secondly, early marriages in our country. As soon as the girl is 16, 17, the parents start looking for their bridegroom, especially the ladies who are living in the village, because 70% of our population is the villagers. So they can't wait till the age of 25, because 25 according to me is the right age for marriage, because after that she becomes mature, her body is ready for sex, for kids. But even if you can't wait till 25, you should wait at least for 22, 23. Alright, but I've seen even 22, 23 age girls not very aware of sex and not very happy. They just don't know anything. Alright, so this is another thing. The partner has to be patient and understand that she may be suffering from some psychosis, some phobia, vaginismus, or she may be having some pain because of some infection, some disease. So you have to be very, very tolerant and you have to talk it over. Okay. Third thing is some psychological factor which may be affecting the lady. She may not be happy with the partner. She may have had a fight with the partner. She may not be happy with the in-laws, not able to adjust. She may be having some drugs or some painkillers, some illness which is decreasing her sexual drive, which is not letting her vagina getting moist. There are so many things that we have to consider, and unless we reduce the stress, the sex cannot happen. So it is not like a switch on and off button that the whole day you're fighting and then at night you have to be happy with each other. It is just not possible. Especially for females, it's not possible. So understanding is very, very important. Now there are certain time periods in the female life when the sexual drive is very low, the sexual drive is very high. When is it low? Menopause. As I told you in my video 2 years back, I've made 3 videos on menopause, part 1, part 2, part 3. Part 3 was totally dedicated to the bony problems, the osteoporosis. So I'll put the link of part 1 and part 2 here in the description. So you can just go through that. It's in English and Hindi both. So basically I have discussed what hormonal changes you go through, because your hormones, estrogen, progesterone, they kind of just go down and they just disappear in menopause. So obviously you have those mood changes, irritability, then loss of sexual drive, loss of libido, your vagina becomes dry, you have pain, bleeding, so many things happen during menopause. In pregnancy, it depends upon from person to person. One person might have a sexual drive going up. I've seen many pregnant patients telling that their libido has gone up and can they have sex. Yes, it is absolutely safe to have a sex, especially if you don't have any bleeding, any pain, no medical problem like low-lying placenta, your doctor is happy, then you can have sex from the day you conceive till the 9th month till you deliver. So that's not a problem. So your sexual drive might go up because of high progesterone during pregnancy, or it might go down because of pain, because of gastritis and many other problems. If you talk about the time period, during the menstrual cycle, the most important time when you are actually sexually active or you have a high libido is ovulation. Now that is science, because your body is preparing for pregnancy. So obviously your vagina your cervix will secrete a lot of egg white like mucus, so that it becomes easy to have sex and for the sperms to go up, because your body is preparing for pregnancy, and obviously then your libido will go high, because unless you have sex you can't be pregnant. So it is just science, it just goes hand in hand. So how do you detect your ovulation? Well, if you remember, I've made a video on that. That video was in Hindi, so the link is already there in the description. You can always go through that, and it tells you when you're having a low fertility, how you gradually go towards high fertility and then peak fertility. So it helps you to detect your ovulation. That's a very wonderful kit. You can just order it and everything is there in the video. People who understand Hindi, it's a video in Hindi. Alright. So these are the time periods in your menstrual cycle, in your lifetime, when you can have low libido or high libido. Apart from this, if you talk about the age, literature says that a lady who is in between 30 to 40 years of age has maximum libido, probably because she's mature enough, her body is mature enough, she's had an understanding of orgasms, she probably has had children, her problems with the social life, with the people around, or the financial conditions, probably she's more stable. So these are the ladies between 30 to 40 who are more sexually active and more happy with the sexual life. Alright, now coming to the remedies. Well, as I said, in the causes, sex education, very, very important. Don't just look at your girl that she's 16, 17, now she should be married and it is the guy's responsibility or the in-laws responsibility to take care of her. No, you have to tell her exactly what it is. You have to prepare her for that. Alright, then partners. Impatience is of no help. You have to be very cooperative. Go to a sexologist, go to a person whom you consider close to you, who can talk to you and sort out your problems. Just sort out, talk it out, reduce your stress levels. Now, sometimes talking just doesn't help. You have to have those happy hormones inside you. Now, what are happy hormones? I've already told you once in my previous video that one of the happy hormone is endorphin. Now, endorphin gets released when you do exercise. Any kind of exercise. It can be walking, it can be running, it can be Zumba, it can be yoga, it can be gymming. Now, one word I would like to tell you, for females especially who love exercising, for females the good exercise is cardio. People who go to gym would understand what is cardio, what is weight training. So weight training is okay for females, even I do weight training, but excessive weight training will increase the testosterone level in you. So it will decrease your estrogen, it will probably lead to early menopause, vaginal dryness, your facial features, your muscular body might change into a male-ish character. You don't want that. So it has to be a balance between weight training and cardio. Cardio and yoga is better for females to boost up your estrogen. Okay, so it can be a balance in case you want to have a nice body with abs and all. So you can keep a balance between weight training and cardio, but cardio is better. Endorphins get released whenever you exercise, so it's a happy hormone. For males, yes, if you want to boost up your testosterone, you want to muscle building, everything, well, for you weightlifting is the best, weight training is the best, but for females, as I said, weight training should be reduced. What are the other happy hormones like love hormone? Well, I've already discussed in the breastfeeding video. Love hormone is oxytocin. It makes you feel loved. You love your little one, you love your husband, you love your partner. So oxytocin gets released whenever you have sex. During orgasm it gets released. It gets released when your baby suckles the breast. So it is the love hormone. What are the other hormones which are happy hormones? Are serotonin and dopamine. These are the two hormones which make you feel happy, make you feel loved. So how do they get secreted? Well, if you're happy, you reduce your stress level by exercising, by talking, by doing whatever you like, or sometimes you may need some medication. Like for example, the menopausal ladies, they might need estrogen replacement in the form of tablets, injections, patches, and many other medications which do not have hormones, because not many patients can be put on hormone tablets. So there are many other things which mimic the work of a hormone, which are not actually hormones but they act like hormones. We are not going to the details of that because I've already discussed that in the menopause video. So there are many other things that can be done. Apart from this, there are certain vitamins and certain foods which you might not be knowing, which boost up your sexual drive because they make you happy. Vitamin A, beta carotene is a part of vitamin A, vitamin B1 and B6, vitamin C, vitamin E. These are the 4 vitamins which help you feel happy and increase your sexual drive. Now you can just Google which all foods contain this. Vitamin C, we know everything which is tangy, like oranges, then what else, lemons, anything tangy has vitamin C. So you can just search, and according to your food habits, according to your choices, you can look for it. Then omega-3 fatty acid. I've already told this in my menopause video that omega-3 fatty acid is an essential fatty acid which your body doesn't manufacture. You have to take it externally. So what are the foods rich in it? You can just Google. Normally in my house I keep flax seeds and I keep tulsi seeds, that is chia seeds. These are very important for you, especially when you are above 40. It is good for your body structure, it is good for your anti-aging, plus it increases your sexual drive as well. Apart from this, there are certain foods like in the Indian foods, if you talk about the spices, then asafoetida, that is hing, we call it in Hindi, then saffron, then turmeric, that is haldi, then what else? Fenugreek, we call it methi. So these are the things which actually, even ginger, we use a lot of ginger. So this actually is said to be an aphrodisiac, and it is said that the Indian food makes the females more sexually oriented or sexy or whatever. When the libido increases because of the smell and the kind of chemicals that these spices release. Apart from this, there are certain fruits. If you are aware of avocado, it's a fruit which is not available in our country, not really nicely, but when I was in UK, I had a lot of avocado and I just love the fruit. It's not very sweet, it's actually, it has no taste, but it is said to be very good for sexual drive. In India, I don't think we get avocado. Once I purchased it, was all rotten inside. So it is not the temperature, kind of temperature that we support for avocado. So these are the certain foods for, especially for non-vegetarians. Tuna fish and salmon fish, these are very good for making you feel good and making you sexually active or increasing your sexual drive. So that's it, guys. I think I've covered most of the things. The most important thing is be happy. Sex has to be consensual. Talk to your kids. I'm a mom of 2 teenage kids, and I make sure that I talk to my kids and they are happy to talk to me and my husband, so that they don't get indulged in wrong habits and they don't end up doing something wrong. because being a medical person, I'm knowledgeable enough to guide my children and to guide any person who contacts me. I get so many questions on Docwise, but I feel that unless you have some knowledge, you won't be able to understand what the doctor is saying, because I get so many smileys, crying emojis that what have I done to my life, please doctor help me. So unless you understand what I'm trying to tell you, you will not be able to understand. Then you will make up a mess, and there are so many depressive things going on around the world. So just don't make this particular part of your life stressful, because sex is a demand of body and you should enjoy it, and before you enjoy, you should know what you're doing. Unless you have the knowledge, you won't be able to do it properly. Alright, so guys, if you like the video, kindly click the like button, subscribe to the channel if you have not subscribed, and share the video so that many people will benefit out of it. So I'll be back again with a new video. Thank you very much for the number of subscribers I have. It is all you, your love, that we have reached almost 1 million. Thank you very much. Take care.